I'm joined now by Dr. David Chung, Vice President of the Royal College of Emergency Medicine in Scotland. Good afternoon to you.
Good morning. Good afternoon.
What do you make then of what do you make of the findings of this investigation? Does it surprise you that people were tested and then transferred?
Well, I think it hasn't. The investigation hasn't covered, in many ways, a lot of the questions we need to ask. So, coronavirus is a new disease, a novel disease scientifically. The way it affects people, the way it spreads, we still don't have all the answers to that. So it is, as we've seen as time goes by, it is quite obvious that things are going to change as we learn things. We might learn lessons the easy way, we might learn them the hard way. I also would think that there are many situations whereby people who've got multiple health problems and advanced problems like dementia, when they're in hospital and we may realise that they are not going to survive this episode and we're in a palliative situation, you do have to think quite carefully about what the needs of that patient are for themselves and what distresses them and what is the most humane thing for them. Being in an unfamiliar environment for anybody who suffers from dementia is very, very upsetting and also quite distressing. But you need to make balanced decisions, weighing the risk of one versus the risk of potential spread of infection. But when the period we're talking about, we were getting better and better at explaining and giving guidance about what the infection control measures which were needed to prevent a patient anywhere, whether it be at home or in a care home, or indeed in a hospital where there hasn't been a lot of patient-to-patient spread, to keep people, staff and other patients safe.
So would you still then, I mean, I know it's with hindsight and we're not saying that there were mistakes at the time, but now would you still move somebody who's tested positive into a care home?
As I said, I think you have to look. We've been able to contain infections within hospitals and prevent cross-infections with pretty simple measures. If you have single rooms, if you're able to do the simple things, wear a mask all the times, aprons, gloves, such like, we have been able to show that you can stop people cross-infecting each other. So if a care home has got that capability, and it is in the interest of a patient in terms of where it is the most humane place to manage them, if we know there is no hope of success, let's say, and we're thinking what's the kind of situation we'd be in, then it should follow, if we're able to maintain those clear infection control precautions, it shouldn't be an absolute mandatory no to transfer them out of a hospital where they may be somewhere where there may not actually be a side room for them, there may be capacity issues there, to somewhere where actually you're able to do those measures better. Now, each individual care home does have a responsibility to be able to implement those guidelines. The care home sector is not a uniform state-owned sector. So you would have to ensure, or hopefully try and ensure, that the care home is able to meet its own responsibilities in regard to that.
So I suppose it all comes back to what we know earlier was a controversy over PPE in care homes.
Well, I wouldn't say so much a controversy. I think the guidance, where controversies have occurred, it depends. It's how the system kind of differs between various areas. So the NHS in Scotland is, a nationwide thing. It's a nationalised entity. It has central procurement and other sorts of things. The care home and social care sort of service is divided up between various providers. So some is state and council providers, some are shareholder-owned companies based offshore, and everything in between. And it's more difficult when you have fragmentation to ensure consistency and cooperation. We have achieved it. The government made a lot of effort to try and achieve it. It wasn't easy at first because there were issues with regards to getting the right PPE, having the right PPE, and that was addressed on a national scale. But this was on a national scale for what was in effect, in many cases, as I said, various different segments of not a state-controlled entity.
The health sector obviously did cope, and the hospitals in particular, fairly well with what happened during the pandemic. But it is still going on, isn't it? And as we look at what's happening, well, there are clusters around Scotland, but also second waves in other countries. How concerned are you that, this is what we're going to be seeing soon? I
think this is a disease which is going to be with us for a while. And I think unless we get an effective vaccine, and although we've got hope there, that's not an absolute definite either. We are going to have to learn to live in a new way and conduct our business in a new way to cope with an infection that we still don't have a totally effective treatment for. And in some ways, that's turning back the clock. That's how everybody in Britain and it used to live before we had effective antibiotics. When there were many, many infectious diseases we didn't have an effective treatment for. In many parts of the world, that's how people still live now. So that doesn't sound ideal, but it's certainly we can do it. And a lot of the measures that we need to try and do it are simple and effective, but do require people to continue to be vigilant and perhaps not become complacent. It may well be the disease might change as well. We have no idea what it's going to do, and we're still learning. Every week goes by when we're able to get more evidence to see how it affects us, how it affects our society, what the best way to do things is. I think we have to accept, all of us, that as we're highlighting, the things we did at the start of the disease were perhaps based on assumptions from other diseases, from other experience, and we've learned that might not be the right thing. And when we learn it's not the right thing, then we change what we do, and we have to be mature about that. And I'm pleased to see over the course of this summer, we've changed many different things compared to what we were doing at the start. With hindsight, it would have been nice to have done that at the very, very start, but we've at least learned from lessons and made sure that we are doing what we're doing now is, I think, the right way to approach this.
Dr. David Chung, thanks very much for speaking to us.